Good morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. In this episode, I am going to focus on another common problem in South Indians, which is known as metabolic syndrome. Nowadays, you must be familiar with this term, metabolic syndrome. It is very common in obese. It is also known as insulin resistance syndrome or syndrome X. As you said, it is a syndrome. That means it is a complex of features seen in a person make him categorized under this problem, metabolic syndrome. Usually the person with metabolic syndrome is an obese. He is also having insulin resistance, so he is a diabetic, and he is having dyslipidemia, so he is more prone for atherosclerotic coronavascular disease. So that is why we are worried. Metabolic syndrome is usually a prelude to diabetes mellitus. A person with metabolic syndrome now can become a diabetic later, established diabetic. A person with metabolic syndrome can develop severe hypertension later. A person with metabolic syndrome can have severe dyslipidemia, atherosclerosis, atherosclerotic coronary vascular disease or coronary heart disease, are commonly known as heart attack later, which is dreaded, which is very common nowadays. So it's a dreaded combo: elevated blood pressure, uncontrolled hypertension, uncontrolled blood sugar level, and coronary vascular disease. All these are a dreaded combo. So there is no point in correcting once he becomes an established diabetic, hypertensive, or he has already suffered from coronary heart disease. Instead, you should identify, correct it at the metabolic syndrome stage itself, so that you can prevent him from ending up with say either end stage renal disease or coronary heart disease or even stroke. So how to identify early, or what is the criteria for classifying a person metabolic syndrome, that he is having metabolic syndrome? So the criteria is, as I said, he is usually obese. So a person with the body mass index more than at least 25, number one. Number two, his waist circumference. If the waist circumference is more than or equal to 90 centimeters in a male or 82 centimeters in a female, he is at a risk of being categorized as metabolic syndrome. Then his blood sugar level. If his fasting blood sugar level is more than or equal to 110 milligrams per deciliter, and his lipids, especially triglycerides, more than or equal to 150 milligrams per deciliter, then genetic factor. If he is a South Indian, then who is indulging in more of carbohydrate diet, so all these factors make him classify as a person suffering from metabolic syndrome. Also, if you record the blood pressure in this subject, if the blood pressure is more than or equal to 130 systolic and 85 diastolic, he is categorized to be under metabolic syndrome. So a person with BMI more than 25, increased triglyceride more than or equal to 150, blood sugar level more than or equal to 110 milligrams per deciliter, waist circumference of more than 90 in male, and he is an overweight, he is a South Indian, then naturally he is categorized as metabolic syndrome. So you should be cautious at this stage itself. You can see from this criteria, it is common among all who we see above 40 years in our clinic. A person who comes to your clinic, a 40-year-old South Indian, genetically he has got a 20% risk of developing a metabolic syndrome. Number two, if he is overweight, another 20% adds on to that. Then his waist circumference is more than 90. Maintaining a waist circumference less than 90 in a male is very difficult. All of us know. You just take a tape and measure the midpoint between anterior superior iliac spine and the lower end of a rib at the level of umbilicus or just below the umbilicus, and you see it is very difficult in a 40-year-old or more men to maintain it less than 90 centimeters. So metabolic syndrome is very common in South Indians nowadays. So you catch them at that stage itself, start treating them, prescribing them healthy diet and healthy exercise pattern. Once they do that, you can preventing them from becoming an established hypertensive, established diabetic, or established coronary heart disease patient later on. Advise them low salt intake, low carbohydrate intake, low fat intake, quit smoking, stop alcohol. aerobic exercise activity of at least 150 minutes a day, a good sleep pattern of at least 7 hours a day, avoid unnecessary stress, then eat a healthy, balanced diet with more of protein and less of refined carbohydrates. All these can prevent a person categorized as metabolic syndrome from becoming an established diabetic or coronary heart disease patient later. Thank you.